You already know what it is, man. It's your boy Kill. So Frosty Flat was the movie. Flat was the movie. 2 on the way. God City TV, Gangster City, God City web series, God City podcast, God City everything, man. Back with some more entertainment news for y'all, man. As y'all already know, everybody was anticipating the Ashanti versus Keisha Cole versus today. It was gonna be a classic. I'm sure the ladies had their liquor ready, they champagne, they wine, they drinks ready. But apparently Ashanti came down with COVID-19. She just put out a message on her Instagram. So right now it's basically postponed. But on her Instagram, she did basically say they are trying to work it out at home. She's not feeling no pain tonight. She's not feeling anything. She basically just tested positive. So you know a lot of people did test positive. Sometimes it was a false positive. So you never know. But for precautions, they're not doing the live, actual in-person thing. Maybe right now, as she says, she's trying to work it out from home. Maybe they'll be able to work it out from home, but it's really short notice. It's supposed to go on at 8 o'clock. It's already 6 o'clock, and this is when the news is coming out. Now, we already know this was going to be a classic because the ladies, I know y'all was in the crib. Y'all probably already went and got y'all drinks, cooked y'all little food, y'all little appetizer, y'all little finger foods, ordered y'all little joint, ready to go. And now this is what's happening. So I know everybody disappointed. Hopefully y'all can still have a little party. Don't get too crazy. You know what I'm saying? As y'all can see, COVID-19 is real, so y'all better be careful out there. You know what I'm saying? Wear your mask. I'm surprised like celebrities like Ashanti even catching it at this point because everybody should be extra careful, and I'm pretty sure they're flying around. I would think that they'll be extra cautious, but you never know. They have so many people around them that they gotta have around them all the time. But anyway, we'll see what happens. Like they said, she's going to try to work it out from home. And I'm saying speedy recovery to Ashanti. Hopefully she feels better soon. Well, she's not even feeling nothing. She said she just tested positive. But hopefully we could watch the show from live. Maybe they could do a home thing or something like that. But I said the show, don't know exactly how it's going to happen. If it's gonna happen, if they could put out another statement before 8 o'clock come, they have to put out a statement. But TMZ already reported that it's postponed. So we're gonna see exactly what's gonna happen. But with everybody tuning in, I'm sure they're gonna try to work something out with the anticipation that this versus had right here. This was gonna be one for the classics. You know what I'm saying? The ladies is gonna go crazy. All the fellas was expecting to get cursed out tonight. So fellas, we kind of came off on this one, but speedy recovery to Ashanti, you know what I'm saying? And Keisha Cole, I know you was ready to do what you got to do. So just be ready when she's ready, you know what I'm saying? Holla at your boy. It's your boy KO. So Frosty, follow me on Instagram. It's at KAYOSOFROSTY. And when you get there, make sure you let me know Gaza City everything so I know you follow me straight from the tube. Holla at your boy. You know, versus is canceled, y'all. The versus is canceled. Yeah, you already know what it is, man. It's your boy Kill. So Frosty Flatbush, the movie 2 on the way. God City TV, Gangster City, God City web series, God City podcast, God City everything, man. Back with some more entertainment news for y'all, man. As y'all already know, everybody was anticipating the Ashanti versus Keisha Cole versus today. It was gonna be a classic. I'm sure the ladies had their liquor ready, they champagne, they wine, they drinks ready. But apparently Ashanti came down with COVID-19. She just put out a message on her Instagram. So right now it's basically postponed. But on her Instagram, she did basically say they are trying to work it out at home. She's not feeling no pain tonight. She's not feeling anything. She basically just tested positive. So, you know, a lot of people did test positive. Sometimes it was a false positive. So you never know. But for precautions, they're not doing the live, actual in-person thing. Maybe right now, as she says, she's trying to work it out from home. Maybe they'll be able to work it out from home. But it's really short notice. It's supposed to go on at 8 o'clock. It's already 6 o'clock. And this is when the news is coming out. Now, we already know this was going to be a classic. Because the ladies, I know y'all was in the crib. Y'all probably already went and got y'all drinks, cooked y'all little food, y'all little appetizer, y'all little finger foods, ordered y'all little joint, ready to go. And now, this is what's happening. So, I know everybody disappointed. Hopefully, y'all can still have a little party. Don't get too crazy. You know what I'm saying? As y'all can see, COVID-19 is real, so y'all better be careful out there. You know what I'm saying? Wear your mask. I'm surprised, like, celebrities like Ashanti even catching it at this point, because everybody should be extra careful, and I'm pretty sure they're flying around. I would think that they'll be extra cautious, but you never know. They have so many people around them that they got to have around them all the time. But anyway, we'll see what happens. Like they said, she's going to try to work it out from home. And I'm saying speedy recovery to Ashanti. Hopefully she feels better soon. Well, she's not even feeling nothing. She said she just tested positive. But hopefully we could watch the show from live. Maybe they could do a home thing or something like that. But like I said, it's short notice. We don't know exactly how it's going to happen. If it's going to happen, if they're going to put out another statement before 8 o'clock come, they have to put out a statement. But TMZ already reported that it's postponed. So we're going to see exactly what's going to happen. But with everybody tuning in, I'm sure they're going to try to work something out with the anticipation that this versus had right here. This was going to be one for the classics. You know what I'm saying? The ladies is going to go crazy. All the fellas was expecting to get cursed out tonight. So, fellas, we kind of came off on this one. But speedy recovery to Ashanti, you know what I'm saying? And Keisha Cole, I know you was ready to do what you got to do. So just be ready when she's ready, you know what I'm saying? Holla at your boy. It's your boy KO So Frosty. Follow me on Instagram. It's at KAYOSOFROSTY. And when you get there, make sure you let me know Gaza City everything, so I know you follow me straight from the tube. Holla at your boy. You know, first is a
be 30 seconds or 40 seconds. We're going to show you the whole interview process here. So take a look at this.
Hello, everyone. I'm News Now from Fox host Pilar Arias, currently joined by Dr. Pierre Corey, who just gave on Tuesday some very emotional and powerful testimony on Capitol Hill. Doctor, how are you doing?
Yeah, a little emotional is correct. I'm doing okay.
What is your specialty? Have you studied? What medicine do you practice? And why were you testifying today?
Yeah, so I am a lung and ICU specialist. So I work in intensive care units. I take care of what's called the sickest of the sick. I've been in academia my entire career, myself and my colleagues. And I also have to be clear. I'm speaking today not on behalf of my own personal or professional opinions, but I am part of a group that we formed early on in the pandemic. Okay, we formed ourselves, led by Professor and Dr. Paul Marik. He brought us together to try to figure out COVID and to try to figure out effective treatment protocols. We've been working tirelessly reviewing the world's literature on almost every aspect of this disease. And so I'm speaking on behalf of our group, which is a collection of scientists. We collectively have almost 2,000 peer-reviewed publications. So I want to be very, very clear on that. It's not just one doctor's opinion that I'm speaking today.
Right. So your testimony, you got very emotional. If you wouldn't mind explaining to me why that was.
I'm a lung doctor. Everyone is dying of breathlessness. The ICUs are filling. They're all on ventilators and they die slowly. They're on for weeks. I run an ICU where there's nothing but patients with COVID. I don't see any other disease anymore. All I see is COVID, 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 and they're all dying. I can't help but emotional. My entire life and my humanity is being destroyed by this. Are you kidding me? This is not the flu. And I'm so tired of hearing that. This is not the flu. I'm losing patients of all ages, all ethnicities, and they're all dying. By the time they get to me in the ICU, I can't turn them around. I can't recover them. And is that a fair answer as to why I'm emotional?
Yeah, your exact words during your testimony were, I can't keep doing this. You're talking about a drug, repurposed drugs in particular, and one that could have a miraculous impact on not just treating, but preventing COVID-19.
Our group, we have come to the conclusion after reviewing months of data that have all come out in the last few months. This is all new data. We never believed that ivermectin was the answer. We thought it might be early on because there was some theoretical rationale that it might work. But what we uncovered in the last 3 months is nothing but repeated studies and trials showing phenomenal effectiveness in multiple areas, not only in prevention, but early and late treatment. And the most overwhelming data is in the prevention of transmission of COVID-19. If you are on ivermectin, the studies and their randomized controlled trials, large and well done, show if you're taking ivermectin, you will not contract COVID-19. I repeat, if you are taking ivermectin, you will not contract COVID-19.
Do you think this is the better option than the vaccines that everybody keeps saying are coming? And today we have the first woman in the UK get a vaccine.
I think they're complementary. I am so encouraged. My group is encouraged by the development of vaccines. We still want to see that data. It has not been peer reviewed and published as far as we know, but we believe that this would be complementary, more rapidly scalable and more quickly scalable. We have too many people dying right now. There's so many people who are going to die while waiting for those vaccines. So this is something that can be pursued immediately and urgently.
The drug, is it ivermectin? I want to make sure I get it right.
Ivermectin. So you have to be clear on what ivermectin is. It already has won the Nobel Prize in medicine for its discovery because of its global health impact. So it's already rid the world of a number of parasitic diseases. 60% of sub-Saharan Africa take ivermectin regularly to rid themselves of the scourge of parasites. What we discovered and what the studies show, it has phenomenal antiviral activity. It absolutely blocks the replication of the SARS-CoV-2 virus, so you don't get sick. The virus can infect, can't replicate, and can't kill you if you're on ivermectin.
Is the drug readily available, affordable, and does it come in pill form, or does it have to be?
So it's a pill. It's a pill, and what's crazy is for treatment, as little as 1 dose is effective. We have a few protocols, and if anyone wants to go to our website, which is flccc.net, it's the nonprofit organization that I'm a president of that was formed by Dr. Paul Marek. We have put out our treatment protocols from the beginning. They're all highly effective. We have one for the hospital, and now we have one for prevention and early treatment. We have the doses on there. So it's oral. Now, is it readily available for the country? There are not enough doses available now to treat everyone. However, we've spoken with some of the one pharmaceutical company that supplies, and they can quickly scale up, and we hope they do. And I'm really hesitant to mention this, but ivermectin is also widely used in animals, and there's veterinary grade ivermectin there. Now, it's not recommended to use because it hasn't been tested in humans, but it's the same drug. It just does not have the same level, same low level of impurities that the human one does. So I can't recommend animal, but that is widely available. And I will say in many countries, especially in South America, they have been using veterinary grade ivermectin.
You said during your testimony that you are not a politician, you are a physician, but what are your thoughts now that you're getting all this national attention after your testimony?
In terms of politics?
Everything, just the attention that you're getting. You're hearing from your people, people are knowing your name now.
I have to be clear, I just walked out of my of the hearing and my testimony, so I am not sure what's going on in the world. All I know is that for 3 weeks, my team, my group, my colleagues, we have discovered the cure for COVID. And so there's nothing new that's happening right now that wasn't changed already. Dr. Marek is the first one who brought our attention to it. He put a video on his YouTube website weeks ago, months ago, and all I've done is work very closely with him at amassing the data. Our manuscript needs to be reviewed by the NIH, and they need to formulate treatment recommendations now.
Now, that is exactly what you asked for the NIH to review your data. And then what? Does it go to FDA? Who does it go to after that?
You don't need the FDA to approve it. I think they just need to provide guidance. If you go to the NIH website on treatment recommendations for COVID, they recommend against hydroxychloroquine. They recommend for remdesivir, which departs from the WHO, which removed their recommendation remdesivir. Their recommendation for ivermectin, which is from August 27th, currently states on the website today, it says, we recommend against the use of ivermectin outside of clinical trials. That recommendation was based on expert opinion only in August. In August, we did not have the trials data that I presented today. A lot has changed. The last 3 months, massive amounts of clinical data has come out. Not all of it has gone through peer review and publications, but it's available. The NIH has the resources to verify and validate with all those study investigators their data. And that's all we're asking to do. We're not saying we found the cure for COVID. We've identified the data. We want them to review and validate it.
Doctor, where did we go from here? Do you think that your requests are going to be answered?
I think my job is done. We need the FDA to review and validate the data and provide guidance. I do not have that authority. The country will not listen to me, even though I'm part of 5 of the smartest guys in the pandemic. Literally, my colleagues are some of the most highly published and well-regarded physicians in our specialty. And although I think we have answers that other people don't, no one listens to us. We need the NIH, the CDC, and the FDA to step in, and even the WHO. I just want to mention, a lot of our data in my manuscript, which is available for review by all of those agencies, also includes epidemiologic analyses by 2 analysts that we work with. And one in particular, Juan Chimie, he has been doing epidemiologic analyses since early on in the pandemic, showing in region after region after region that as widespread distribution of ivermectin, case counts and death rates plummet. Numerous examples of that. We know that this is effective.
There were 3 groups of people that you mentioned are being impacted the most and are dying from COVID-19. I think you said African Americans, Hispanics, Latinos, and the elderly. Is that right?
Absolutely. We know, and I don't know if this is the right term, but you know, our units are full of those who are Black and brown and the old. It's just our Hispanic brothers, and our African American and our elderly patients, they are being decimated by this. There's just countless death. Our ICUs are full of them, and their families are getting destroyed. I mean, we have a solution. It needs to be reviewed, validated, and we need guidance.
If you could ask anything of the general public right now, especially ahead of the holidays, everyone's wanting to gather, what would you ask them or tell them?
We need guidance to implore our governmental healthcare agents and leaders who we've depended on throughout this pandemic to do your job. To do your job, review these data, listen to our advice. We are a group of experts. We have formed, our entire group has done nothing but research on repurposed drugs. We know the drugs that we know the drugs that we learn, and we're experts at all of them. This is our recommendation. We need them to hear us out. And so we need to implore our government and leaders to revise their recommendation. It's 3 months. Old, over 3 months old. They need to update it now.
All right, Dr. Corey.
Good morning, everybody. I am Dr. Joseph Baron. I'm the Chief of Staff and Chairman of the Board at United Memorial Medical Center. I want to welcome all of you, both the people that are here present, as well as those people that are following us on social media and live streaming in other measures. Today, I'm surrounded by two excellent clinicians that are here to help me explain to you what is so important to call in a press conference on December the 4th. And let me tell you how this all starts. First of all, you should be aware that we have absolutely no conflicts of interest on what we're going to be discussing. We have no shares, we don't belong to any speakers bureau or anything related to the medications that we're going to be talking about. What we are is we are a group, we are an alliance. In March, when we saw that COVID was killing people, we formed a group of doctors, 5 of us, which initially started to talk as to what do you do, how can we do things better, and we created an alliance. We created an alliance with people, and very humble, but people that have written among all of us more than 2,000 peer-reviewed papers. People that are usually sought for consultations by other doctors, by people asking us to be experts on a variety of different things. Most of the people that are part of our group have been well known for their things related to research, academia, but most importantly, all of us were caring for patients that have COVID, critically ill COVID patients, patients that are dying, patients that are getting into our unit. So we created a non-profit organization. And again, our primary mission was to develop effective COVID treatment as well as prevention of COVID. And the reason was because we wanted to improve patient outcomes. Our patients were dropping dead. We were getting extremely concerned. So one of the things that we did is we created the Math Plus protocol. And we actually were one of the first ones to show that this illness was extremely steroid sensitive. That means cortisone sensitive. And initially people looked at us like, what's wrong with you guys? I mean, you're going to give steroids to somebody that has an active infection. But then we proved that we were improving outcomes. In this hospital at United Memorial Medical Center, our mortality rate, since we implemented Math Plus protocol, has been less than 5%. I mean, that's a huge improvement as compared to the rest of the country. So we create that protocol, but then we realized that people were dying. And that's why we're here today. Today, December the 4th, we're calling people to action. It is a time of national and a global health crisis. Just yesterday, those of you know it, those of you members of the press, more than 210,000 new cases of COVID in the United States, more than 3,000 deaths. Just to put that in context, cardiac conditions, heart-related conditions kill about 500 people a day. COVID killed 6 times more people yesterday. So we have to do something about it. And I know that the vaccines are coming. I know that those vaccines are required and we need to have them all. But let's be real here. It's going to take some time to get everybody vaccinated, to convince people to get vaccinated. Therefore, we need to come up with a different approach. We need to come up with a secondary approach. We need to come up with an alternative approach that's going to help us. So today, my colleagues are going to be talking to you about this tiny little pill that we can use for treatment and for prevention. Fairly straightforward, in addition to some of the things that we do. With that in mind, I am going to go ahead and get started, and I'm going to introduce Dr. Paul Marik. Dr. Paul Marik has been a friend of mine for more than 30 years. We have written together, gosh, I can't count how many papers we've written together. He is a professor of medicine in Norfolk, Virginia. He is extremely well known for his work in the area of infections, specifically overwhelming infections such as sepsis. And I see him as a master of science. And for that reason, when we started working together and we decided that we were going to talk about this, we said, hey, who can come to Houston? And Dr. Marik will be talking to us about the eye mask protocol. Dr. Marik.
Thank you, Dr. Varone, for that introduction. So what I'm going to be talking today is I'm going to be talking about COVID-19, the spectrum of disease. I'm going to focus on prevention and early treatment, which we think is key to controlling this pandemic. What we want to do is limit people being admitted to hospital. We have all seen what a terrible disease this is. Please do not underestimate this disease. Patients are being hospitalized. They suffocate. They suffer a prolonged course in hospital, and then they die. Those who recover have significant ongoing problems. We know about the long haulers or post-COVID syndrome. There's something we need to do about that right now. So we're going to talk about pre-exposure prophylaxis. So this is prevention in treatment in people who are at high risk of getting COVID. This includes healthcare workers and people in long-term care facilities who are at a high risk of getting COVID. And what you do is you treat these people preventatively. We're then going to talk about post-exposure prophylaxis. So these are folks who are being exposed to a patient who has had COVID. The most common scenario is a family member. We know that if someone in the family has COVID, half the other members in the family will get COVID. And we know how many couples, husbands and wives, die from COVID from getting it from each other. Then we're going to talk about early treatment, and we think this is the key, that patients who get COVID need to be treated early at home. What is the point of waiting at home until you get overwhelming lung disease and you cannot breathe and are then admitted to hospital? That makes no sense. We want to treat these people early, at home, to prevent them progressing to the late phase. Now, while we have the MATH protocol, which has had an impact on the hospital treatment, patients are still suffering and patients are still dying. So we have to put our emphasis on the prevention and early treatment of this disease. And we believe we have a solution. That solution is the iMask Plus protocol. This is for the prevention and early treatment of COVID-19. The prevention or prophylaxis protocol is based on Ivermectin, which is, as we'll see, a remarkable antiviral agent. In addition, we add some therapeutic agents which increase the host's immune system so that he can fight off infection. We then move to the early outpatient protocol, and it's essential that treatment be started in early. Once the diagnosis is suspected or confirmed, patients should be treated early with the goal of preventing progression to the stage where patients have to be